Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the Health Flow Podcast. Awesome. Okay. Hello, everyone. Welcome to episode number 31 at the Health Flow Podcast. And it's my pleasure to have Dr. Gabriele Miotto. She's assistant professor of surgery at the Division of Plastic and Reconstructive Surgery in the Department of Surgery at Emory School of Medicine. Oh my God, I got it all out. She's a board certified plastic surgeon with clinical interests, which includes surgical and non-surgical facial rejuvenation, rhinoplasty, eyelid surgery, fat grafting, and aesthetic breast surgery. So she's here on the podcast, and I'm so excited to have her. Welcome, Dr. Miotto.
Thank you so much for having me. It's such a pleasure.
Oh, the pleasure's all mine. So yeah, we want to talk about what you do, plastic surgery. You can tell the audience more about yourself and how long you've been doing this.
Yeah, so I am a plastic surgeon and I specialize in aesthetic surgery of the face, breast, and body, but I do focus mostly nowadays on the face and breast specifically. I still do a body contour, including liposuction, because that's the most common procedure we actually do in plastics worldwide. So liposuction, nobody wants the unwanted little fatty deposits around the body, so that's a very popular thing. So I have been doing this for more than a decade. Mm-hmm. I really enjoy seeing the difference that I can make in people's lives, in their self-esteem, the way they see themselves, the way they interact with the ones around them, just from being able to change what is bothering them in their body.
Right.
Sometimes it's something very minimal, like maybe they want a little less wrinkles around the eyes, or they have a brown spot that they want to clear. Mm-hmm. But sometimes it's a major change, like women that had kids and have a lot of excess skin in their stomach, or the breasts have become droopier or smaller than they were before they had kids. So that's really just trying to make them feel whole again and feel like what they want to see in the mirror is basically reflecting outside the way they feel inside.
Right.
And it's my goal to try to understand exactly what they want, because then we have a very good chance of being successful.
Right. Okay. So let's talk about the non-surgical rejuvenation, facial rejuvenation.
Yeah, so there are so many things we can do because our face is basically layered. We have several things that we can do that start from the skin. So skin care, that includes a lot of things that patients can do at home. So skincare at home, they can come we have a spa at the Emory Aesthetic Center, so they can come and have facials, microneedling, chemical peels, some kinds of lasers to improve skin texture. Okay. And fine lines, and also discoloration, so the dark spots that show up after being, in the sun, or even from genetic characteristics.
Right.
Then I usually also do a lot of injectables. So injectables are non-surgical procedures that we use to improve usually facial shape, volume, and wrinkles.
Okay.
The most popular ones are Botox, so botulinum toxin, which is a product we inject in the muscles of the facial expressions, around, so crow's feet, the 11s in between the eyes, the forehead lines, and we soften the muscles so they don't form the wrinkles during a period of time while the Botox is working. Usually lasts for about 4 months.
Okay.
But sometimes we cannot treat some things like the deep folds around the mouths or the marionette lines or some cheek volume that has been just going down as the patient's age. So
Uh-huh.
for that, we need to replace volume with volume. And we use then fillers. Specifically in my practice, hyaluronic acid fillers, because of their safety profile. They are absorbable, so they do not last forever. But that's a wonderful thing because it ages with the patient. And if the patients don't like the way it look, we can actually remove it with another kind of injection that actually melts the filler away. So
Okay.
that's a very good safety profile that we always pay attention, because we don't want to have problems for someone that is looking to good to is thinking about looking better. So we would like to use products that are as safe as possible to give that result.
Right. And that's one of the number one things that people ask is, well, how safe is this Botox and how safe are the fillers? What do they do inside your body? Do they, can they cause further damage? So just speak about that a little.
Yeah, so let's start with Botox. So Botox is a toxin, is botulinum toxin, but the way we use is synthetically made. So the way we use Botox is localized. So once we inject into a muscle of the face, it really doesn't spread to the body.
Right.
It stays right there. And our body removes it from like with time. So usually takes about 3 to 4 months for our body to completely deteriorate, like degrade and like break it down, and then we just eliminate like a neutral molecule.
Mm-hmm.
So although there are cases of people, for example, if they have neurological conditions, if they had history of allergy of some of the components of the formula, yes, they should not have Botox. But in more than 10 years of experience, I've never seen an allergic reaction to Botox,
Mm-hmm.
and I've never seen any side effect that is just not local.
Right.
So it's very safe and has been extremely well studied.
Okay.
So for me, I have been using that myself for almost more, I don't know, more than a decade, I would say, regularly.
Botox.
Uh, and that's, I usually like to test things on myself before I kind of
Right.
offer to the patients. So Botox and then fillers. Yes, there are fillers that they're not good.
Mm-hmm.
We don't inject silicone. We don't inject methacrylate. Things
Mm-hmm.
are permanent. They don't age well. They can get infected. They are not removable unless you do surgery to remove them,
Right.
and they do not age with the patient. So we don't use those. So
Okay.
hyaluronic acid fillers, they are gels made with hyaluronic acid.
Mm-hmm.
Hyaluronic acid is a molecule present in between our cells in the skin
Uh-huh.
that actually makes the skin hydrated. So
Okay.
it's basically we are replacing some lost hydration and volume. And once the filler is in the body, it actually attracts water to it. So it makes the tissues even more hydrated. So
Okay.
it's not just to also improve volume or like create a cheek or improve the facial shape, it's also to moisturize the skin from the inside. So
Got
we break fine lines, we even, there are studies that show the hyaluronic acid, the injectable ones, we also have the capacity to produce more collagen because of the injection. So you're actually stimulating your own body to produce more collagen when you have hyaluronic acid injections. That also happens with Radiesse, which is a semi-permanent filler. It
Right.
is completely biodegradable, but it takes much longer
Mm-hmm.
to be absorbed,
Okay.
and it also makes the body produce collagen. So I use this filler for some patients when we just want really like more deep structuring of the face, so when we are contouring a jawline or maybe cheeks. But I can also dilute it and make it be a biological stimulator of collagen, so I
Okay.
can inject it in other parts of the face as well.
Got you. One thing I didn't hear you say, maybe at the aesthetic center, do they do the PRPs?
So we don't use the PRP,
Okay.
but we use a synthetic growth factor. So the value of PRP is
Mhm.
the growth factors that are in the blood,
Yes.
right? So the PRP has been studied for, skin texture improvement and pore reduction, but we do have to draw blood from the patient. We
Right.
have to prepare that, and
Hmm.
we can get basically the same quality of a product that comes already ready to go in a bottle. So
Gotcha.
if you can make life easier and use products that are equivalent and will give the same results, I think it's a good thing for the patient.
Right.
But and also there are not many really solid studies that show, well, this is really what's supposed to be, is much better than the synthetic one.
Hmm.
So the growth factors that are produced synthetically. So we use growth factors
Right.
with microneedling and with other products, other skin products, skin treatments, but
Right.
not the PRP.
Okay. Gotcha. Because it's less, probably not the cost effectiveness, but the ease, less
The
time
it's
for
just yeah,
patient. You
it's
don't have
just
to, like you said, draw blood.
you
It's
don't
just
have to draw blood. Exactly. To
just
some
grab
people,
it.
that's really like, I don't want to draw my blood. I just want to have a facial. I just want to, have my skin taken care of.
Right.
But I
Right.
understand that a lot of people, a lot of providers offer that, and it's
Yeah.
not a bad thing. It's a
Okay.
good thing as
It's a good
well.
thing. All
Yeah.
right. Okay. So let's move on to rhinoplasty.
Yes. So rhinoplasty has evolved a lot during the last 2 decades, 1 to 2 decades, into a much more preserving procedure and shaping procedure than a reduction procedure. So in the past, people would just oh, I want to do my nose, and then they have those tiny little noses, scooped up noses that would not breathe well also. So what do we do now? We actually try to preserve the cartilage and the structure of the original nose as much as possible, and we try to change the shape of the structures,
Mhm.
because the shape is what causing the nose to look bad or to
Right.
not look as beautiful as it should.
Okay.
So it's a very nice procedure. It needs to be done in a way that also preserves the function of the nose, because we would like that the nose would be breathing well after the procedure, not
Yeah.
just looking good. although
Okay.
although it feels like, okay, I just need my nose to look good, but long term, that's really not a good thing to not be able to have good functional,
Mhm.
because the nose is a very important organ in the body. So yes, it's a wonderful, rewarding procedure. It does have a downtime of 1 to 2 weeks, because sometimes, most of the time, there's some bruising and swelling around the eyes and the nose, and tape and a little cast, depending on how much work it needs to be done.
Right.
But it's also possible to have a beautiful nose that breathes well.
Okay.
I like that concept.
Absolutely. It wouldn't be helpful to have a beautiful nose and you can't breathe. Not at all. What about eyelid surgery?
So with the eyes are very interesting. The aesthetics of the eyes has also evolved so much, because I would also say that in the past, most surgeons, the approach was always like, well, if there is skin hanging on the top of the lashes, or we just remove the skin, and we don't really look what's really going on with the aging of the eyes. Or if you have bags under the eyes and it's puffy, you just remove the puffiness and that's okay. But the fact is, we age by losing volume, losing fat in our face. We accumulate fat in other places, but we lose facial fat. So the eyes, as we look at the studies and the way most people age,
Mhm.
we age by losing volume around the eyes more than by droopiness.
Right.
So the modern eyelid surgery is basically a combination of sometimes having to remove a little skin, having to remove a little puffiness, but
Mhm.
also reposition the brows and the eyelids to a place where they used to be,
Mm.
to make the shape look beautiful. It's not like just no skin hanging in there. It's just like, we like to see that the eyes have been rejuvenated. And
Right.
we use the patient's own fat in most of the cases to also It's like a removal and addition of things. We remove the excess fat, we lift the brows or even the lateral canthus, so the lateral sides of the eye to reshape it, but we also add fat because without fat, it looks hollow. It looks like it's just, there is no rejuvenation.
Right.
It's not as, you don't see the skin there, but at the same time, it's not rejuvenated. So if you don't use fat or volume, the result's not that optimal. So it's a very common trend and as part of modern eyelid surgery to take what is excessive, but also to replace what has been lost.
Okay. And what's the recovery time, the downtime for that?
Yeah, so for upper eyelid surgery, the upper eyelid surgery is actually much more simple than the lower eyelid surgery.
Okay.
So if it's just upper eyelid, for example, and it's just a little skin that we need to remove, we can do that procedure even under local anesthesia with the patient awake.
Okay.
Very easy. 5 days. For 5 days, you have sutures that are removed, and then you could have swelling and bruising up to 10 days, depending how much the patient swells. Okay. But it's quite a satisfying, simple, very short downtime procedure. If we need to add fat, it always takes a little bit more of swelling and bruising for the patient to recover.
Right.
And the lower eyelids, it really depends what's going on. Mm-hmm. If there is a lot of puffiness, there's a lot of skin loss, loose skin, or even if the eyelids are a little bit loose as we age, the lower lid gets a little bit loose, then we need to just see how much work needs to be done. Okay. And then the more work you need to do, the longer the recovery. Mm-hmm. So usually for lower eyelid surgery, I would say the ones that I can do from the inside of the eye with no external cut, which is for patients that have puffiness only but good skin. I don't need to remove skin. Mm-hmm. That's a very quick recovery, a week to 10 days. If I have to also remove skin and reposition the muscle and change the eyelid shape, then I would say it's more like a 2 weeks to 3 weeks recovery. Gotcha. So it's very variable. It depends on the type of problem that the patient has.
Gotcha. Very nice. Very nice. All right, let's talk about fat grafting.
Fat grafting. So we talked a little bit about fat grafting to the face, right? Mm-hmm. So fat grafting can be what is fat grafting? Fat grafting is we do a liposuction in whatever part of the body the patient wants us to do, usually stomach. Very easy. Everybody has a little bit of fat there. Right. Take that, the small cannula, remove the fat exactly like a liposuction procedure. But then instead of throwing that fat away, we prepare that fat as a filler. Okay. So it's the patient's own filler, a natural filler. And then we can use the fat to inject into the face, into the breast, into the buttock, and in any other parts. But those are the 3 most common areas. Okay. So for the face is usually in combination, or instead of filler, I can use fat, or in combination with other surgeries like eyelid surgery or even a facelift. Mm-hmm. Patients start losing fat in the nasolabial folds, around the mouth, or even to augment lips. I can do that with fat.
Oh, wow.
Yes, and for the breast is something very interesting because we can get some mild breast augmentation with the patient's own fat. So if patients don't want to have a breast augmentation, don't want to have silicone implants in the breasts, and they are okay with not having a huge, a huge difference in volume, right? But more maybe half a cup or even a cup larger, it's possible to also prepare the fat and inject in the breast. Gotcha. So you can have breast augmentation with the patient's own fat, which I think it's a wonderful thing. Yeah. And we can also add fat, even if the patient has, breast implants and they want a little bit more, we can always just cover the breast a little bit more with fat. So it's a very natural product for us to use. Right. And then, of course, very popular for the buttocks. Yeah. The Brazilian butt lift. Although I have to make a parenthesis here because I am Brazilian. And Brazilian butt lift doesn't exist in Brazil. It's
Where
an
did that
American
come
name.
from?
An American name, I think it's marketing, because apparently they think Brazilians have beautiful butts or large butts. I don't know.
Wow. Wow.
So they created the name Brazilian butt lift. But when I came to the US, I didn't know what a Brazilian butt lift was, and I was a plastic surgeon in Brazil as well. So, anyways, just a parenthesis. But what people call Brazilian butt lift is basically, again, liposuction, remove the fat, prepare it as a filler, inject into the buttock.
Right.
This procedure has been very scrutinized because is the procedure that has caused lately most of the deaths in plastic surgery.
Mm-hmm.
Why? Because there is a limit of how much fat can be injected under pressure in the buttocks before it goes into the main blood vessels. And that's what causes death. So fat embolism, and then it goes into the lungs and the heart, and there is like just cardiac failure and respiratory failure. So there is actually in Miami, you have to really prove that you have been injecting the fat in the right spaces now, because most of the deaths, I think, it happened in Florida because people were injecting tons of fat into the buttocks.
Right.
And then it would go into the vessels and patients will die from that.
Wow.
So yes, it can be done safely, but it's usually not at very large volumes. So usually patients need to do more than one session, if they really need to have a huge improvement, because part of the fat that is injected usually goes away. Mm-hmm. So usually half of it goes away per session. And then if there is a need for more, you can do more liposuction and inject fat again, because then the tissues distend a little bit. It becomes a little better, easier to inject fat in the surface of the buttock. We don't inject in the muscle anymore. We inject only in the subcutaneous plane.
Okay. Also, we used to inject into the muscle, the fat.
Yes. And that was the big problem, because they were injecting. I mean, some people, I believe, is still injecting to the muscle, but that's when the problems happen, because the big vessels are inside the muscle.
Got you.
So if you are on top of the muscle, you're not going to be injecting in any blood vessels. So that's the safe way of doing it.
Yeah. And I know here in Atlanta, and especially me, myself, being African American, that seems to be a very popular procedure that lots of people are out there doing and not really understanding.
Yes.
And not, I want everyone to know about the safety about this, because not because a patient asks for a thing, you should give it to them. Exactly. You are the provider, you're the professional, you've had the training, you really should, and that's one of the things that I admire about you, is that you're thinking patient first. You're not going to do, just because that's what someone comes in your office and asks for, you're not going to do it. You're not going to exceed the bounds of, your practice just to please someone, when potentially it can do harm. And
I think that is very important to me, because my goal is to do the best service that I can, and I know the limitations of what I provide. Yes. As also a teacher, and I train plastic surgeons to become plastic surgeons. I'm a faculty at Emory. We know the literature. We know what the problems are. We are responsible for, providing good advice. Of course, there are people, I believe there are other plastic surgeons that would do that. Yeah. Some of them do well, but there is a risk.
Yes.
And the risk is injections inside the muscle and go into the blood vessels. And that's real. That's why there is such a powerful, media on top of that, and the deaths happen because of that. So we usually don't have deaths in plastic surgery. It's not a common thing. Yes. We try to also optimize the patient before surgery, make sure there are no other major risk factors to go under anesthesia. We have a limit of how much time we keep a patient under general anesthesia to avoid risks such as blood clots to the legs, embolism, and death, which is something that can happen just because there isn't statistics. But if you want to keep that low, we got to pay attention to what we are not supposed to be doing.
Absolutely. And even something new I learned from you today is the amount, like it should be repeated injections if you want to accommodate
More.
the volume.
Yeah.
And I know for sure I've seen other people who, have these massive butts that they've gotten somewhere from some surgeon, and we won't mention any names, and they didn't have multiple procedures. So
Yeah.
now that you say that, it's so alarming to us. I mean, just we want everyone to be safe and to get, just because a person is doing it, you should sometimes do more research.
Yes,
Make
exactly.
sure you research what the safe practices are.
Yeah, I think that's important. And also, there are other non-surgical ways of enhancing the buttock that we can do. For example, we can use Sculptra, which is a type of filler that kind of builds up collagen and is structured to the tissues. We can also use Radius. So there are non-surgical ways of also creating more volume to the buttocks.
Oh.
And we don't necessarily just need to have fat, because some patients are really thin. They don't have fat enough to create the contour that they want, and we can improve that contour also with injectables. So
Okay.
that's another option for the patients. But I understand that everyone would prefer to have a single procedure, right? That not to go multiple times under general anesthesia and things like that. But I really, from my philosophy of practice and the way I would like to treat my patients, I just prefer being safe. And I think that also, makes my relationship with the patients something really special, because I'm not really interested. I'm interested in long-term relationships with the patients. I think that's wonderful. And if we can provide that by being safe and also delivering good results, I think that's all I want.
Absolutely. Absolutely. Okay. Any other last minute advice, or, for someone who's on the fence about surgery, what can
Yeah.
you tell us?
Yeah, I think you should go and see more than one surgeon. Do your research, go visit, do your research online. Say, oh, I think I like this person. I looked at the pictures online. I look at the reviews of the surgeon, and then look for a facility that is accredited. So there are organs that actually accredited the OR. The ORs are not all the same. Some of them have less resources than others. Like, where is going to be the recovery room? Who's going to be taking care of me? Is there an anesthesiologist all the time, 100% of the time in the operating room with me?
Right.
Is the surgeon that's going to take care of them in the post-op period, or they're not going to be seen when they need to be seen. So those things are very important, because also it makes everything safer, but also the experience that the patients have with the whole process is much more reassuring and is much more pleasant. So I just think the patients need to do their research, go see some surgeons. Sometimes even you can ask to take a look at the operating room. Where is the recovery room? Just make sure that's an accredited facility and has the resources. If something happens, there is safety to take care of the patient. There are, resources, and there are policies in place that we can do the best and not have any major issues.
Yeah, that's an excellent point that you make, because it's not just having the surgical procedure. The recovery time, sometimes you don't know that a person's going to react differently to anesthesia per se. And you need to know that there's qualified people there to handle any, thing that could happen, because you can't predict it. You just don't know who's going to react. You need to know that anesthesiologists and certified nurses are all there to help with the recovery period. That's an excellent point.
Yeah, the team is really crucial, and having that connection and having the certainty that you'll be taken care of appropriately after surgery, I think is really like just peace of mind.
Okay. All right. So can you tell us your office location and any, way we can contact you if anyone's interested? And
Yeah,
I'll definitely include all of that in the show notes for sure.
absolutely. So, although we are a part of Emory, the Emory Aesthetic Center is an standalone facility in Buckhead. It's exclusively is a place that is we have exclusivity of aesthetic procedures there.
Mhm.
So our nurses, our coordinators, our anesthesiologists, they are used to do aesthetic surgery every day. So
Okay.
it's really is one-stop shop. We have the offices there. We have 3 operating rooms with recovery rooms, even with overnight suites and with private nurses if the patients would like to stay overnight.
Mhm.
And also we have the medical spa with facials, peels, products, medical products for skincare, and even cool sculpting, which is a machine that does non-surgical fat removal from the body. So instead of liposuction, you can also do cool sculpting, which is non-invasive.
Okay.
So the office is really in the heart of Buckhead, and is the number for the office is 404-778-6880, and then the website is www.emoryaesthetics.org.
Okay.
And if you include all that information afterwards, I think it'll be easier probably for the
I
listeners
will. I
to
will.
find us.
All right.
But
Awesome.
yes, it's easy to get. It's not in the main. It's not associated with any main Emory hospitals, though. It's a
Okay.
very nice, like private practice setting facility.
Okay. Awesome. Thank you so much. I appreciate all that you shared with us today.
Thank you so much. It was a pleasure to be
Uh,
here and talk to you.
All right. Thank you.
Thank
Take care.
you.
Bye
Bye.
bye. Thank you for listening to the Health Flow podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram at thehealthflow, also on Facebook at The Health Flow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.